Now on the tripledemic of viruses across the country, let's bring ABC News medical contributor Dr. Alok Patel of Stanford's Children's Health. Thanks for joining us tonight.
Juju, I'm honored to be here, but I wish we were talking about something less insidious.
I agree with you, Dr. Patel. Just give us a sense first of what you're seeing in hospitals right now. We've got the colds, COVID virus, RSV, and the flu cases. And how are hospitals and hospital capacity being impacted?
Oh, they're being directly impacted right now. You can tell that from that CDC map of how many millions of people out there have cold and flu symptoms. So we're seeing at children's hospitals that are especially full right now in some parts of the country. We may be seeing the early signs of an RSV plateau, but Juju, with influenza, that is still rising. And it's not only affecting people who need to come to the hospital, it's affecting the outpatient world as well, clinics, and people who need medical care for something that's not related to a respiratory virus as well.
I've known as Dr. Mom, so tell us, how do you spot the key differences between a regular cold and potentially something more serious, especially one of those viruses? What symptoms should we be watching for?
The first thing that people should do is just take a quick deep breath and remember that the majority of respiratory viruses will not result in an emergency case or needing hospitalization. But Juju, it's an important thing for parents to understand the signs of respiratory distress. If your child or a loved one is breathing really quickly, gasping for air, really struggling to move air, that is something that should be seen by a medical provider immediately. But we're also seeing cases of dehydration secondary to really bad respiratory viruses, even altered mental status. So things like confusion, disorientation, or even seizures. Any of these, go with your parental instinct and get to medical care.
We're seeing lots of news reports, including from our own Ariel Rushif, that there are shortages in over-the-counter cold and flu medications, as well as some antibiotics like amoxicillin. What do parents need to know to be prepared on that front, even before their child gets sick, for example? Or do you think people are hoarding?
I hope people aren't hoarding. We have seen that behavior before in the past, but I can't exclude it. Now, Juju, when it comes to medications like Tylenol, ibuprofen, parents need to know that they can call around to other pharmacies. There might be another supply available. And remember that generic medications are a perfectly safe and acceptable alternative to brand name ones. They should be able to find them. It's just going to take a little bit more work. But an important note with antibiotics, such as amoxicillin or the oral solution that young kids take, talk to your doctor, talk to a clinic. They may be able to call around to other pharmacies. What you do not want to do is to substitute another antibiotic or to use a different antibiotic, maybe an adult concentration, and try to dilute it down to yourself. I've heard of this happening. That is unsafe and dangerous. Such
good advice and such good warnings. I can't believe it's 2 weeks to Christmas, but what concerns you in the weeks ahead as people gather for holiday gatherings?
You just said it right there. It's the gathering. It's people coming together indoors, wanting to celebrate. This is our third holiday season with these looming headlines. But Juju, we mentioned that RSV, there's a lot of RSV in the community. Influenza is only rising, and COVID-19 is showing an increase in cases right now. We can't ignore the fact that we're still seeing about 150 to 200 deaths per day. So as people are getting together, remember, masks still work if you're symptomatic or want to be extra cautious. Tests are a good measure if you're having those holiday gatherings. And you need to give a round of applause to anyone who stays home if they're feeling sick, because that is an important protective move. Common sense is so important in these days. Thanks so much, Dr. Patel. Thanks for your insights.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.